Welcome guys. Today we are going to talk about the wonderful world of evening primrose oil. In all seriousness, I get a lot of questions about evening primrose oil. I have used it in my last 3 pregnancies. It has been suggested to me by many wonderful, very knowledgeable women. But as always, I will start this video by saying I am not a doctor, I am not a midwife, I am not an OB gynecologist, I am not any of those things. I do not have a certificate in medicine, and anything that you do with your body, always consult your doctors or whatever team you trust most, and also do your own research on the side. So we will go ahead and get into this. So evening primrose oil comes in usually 500 milligram capsules, but I think that they come in more, but I would always recommend getting these, the smaller ones. It doesn't have to be this brand specifically. They have Nature's Bounty evening primrose oil, but just make sure it's coming in the soft gels. And usually people, so my case is a little bit different than others, so I'll just start off with what I do, and then you can go off of what you think is best for your body and what your doctor thinks is best for your body. So my cervix is tilted. It does not like to move forward. Each and every one of my children, I have gone to 40 plus weeks. So you're probably thinking, well, if this is supposed to ripen your cervix and everything and get you ready, why didn't you go into labor? So that's kind of why I wanted to go into detail about it. My cervix is so tilted always that I have period problems, so menstruation issues down there. I have issues wearing tampons. I have issues with intercourse. I have issues dilating in pregnancy. With my first pregnancy, I didn't know about evening primrose oil until I was already 40 weeks. And I wish I would have known sooner, because after taking evening primrose oil, I would never ever start it if your body is normal, like if you have a normal cervix, normal anything, I would start it around 38 weeks personally, because 38 weeks is when baby is absolutely healthy, perfect, ready to go, gung-ho. Anything plus that is just packing on weight. If you had a circumstance maybe a little bit more like mine, where you have trouble dilating, you have a lot of issues, you know, something like that, talk to your doctor. But I usually start around 35 weeks because I need that little head start to like get my body going. Right now I'm currently on my 3rd pregnancy, and I took one 500 milligram capsule every couple days since starting 33 weeks. And at 35 weeks, I will start taking one capsule and inserting one capsule, but we'll get into that in a minute. When it comes to taking evening primrose oil, it's a fatty acid. And so what it does is when you take evening primrose oil, it goes through your digestive tract and everything, and that oil is going to help soften and ripen your cervix, which basically, if you don't know, you have to go through, I guess to not do it in medical terms, your baby needs to not only break down the wall of your cervix, but position into your cervix, and then it needs to open up. So there's 3 levels that your baby has to go through in order for you to give birth. And so you want position to happen correctly, which you can do by bouncing on the ball and, you know, walking and all that stuff to prepare yourself for labor. That's how you get the position correct in most cases. And then some cases need help, obviously. And then in order to soften the cervix, your body needs to start, you know, getting the natural hormones and everything to start breaking down that wall of thickness. And so that's, you know, when that really gets thin, that's when you know you're ready for labor. And then when you dilate, you know, you start off closed and then you start to open. So what evening primrose oil has done for me, and done for a lot of my friends and people that I've recommended it to, and other people that you can do more research on, is it's helped soften that cervix slowly and at its own time, but it gives it that little adjustment. It's kind of like the lube of the cervix, if you will, which is why it's my favorite. I do not condone castor oil ever. So people that do evening primrose oil, it's a very less invasive, it doesn't cause like the diarrheas and stuff, at least it shouldn't, if you're taking it correctly. And it's just a very natural for me, a more natural way to kind of just prepare for labor, kind of like, you know, using red raspberry leaf tea. If it's done right, you know, it's good for preparing for labor. So what I would start doing is I would take 500 milligrams at 35 weeks. For you, it would be more like 38 weeks. And then slowly up your intake. When you get to, you're closer to your due date, let's say 39 weeks, 40 weeks, and your practitioner feels more comfortable, I would say up to 2,000. 2,000 to me is the maximum that you should be taking orally, but I would start slow. So if you're taking 500, then take 1,000 for a little while, then take 1,500, you know, and then when your due date's there, then take 2,000, you know what I mean? So just slowly upping that intake can help soften that cervix. And, you know, as your doctor is checking your progression, if she's going to do that, you know, she can tell you how far along you're dilating. For my example, for my first daughter, I stayed about at a 1 to a 1.5 centimeter. I actually didn't even get to 1.5 centimeters until I started taking the evening primrose oil, and that was with help with my doctor trying to stretch my cervix down. So unfortunately, I didn't have it sooner with that pregnancy, and I wish that I did. With my second pregnancy, I got all the way up to 4 centimeters by myself before I had to be induced. So that was amazing. And instead of having a 19-hour labor, 14 hours without an epidural, my second pregnancy with taking evening primrose oil, it was a 6.5-hour labor. I was already a 4, my cervix was ripe. I immediately reacted to, they gave me Pitocin with my second. I immediately reacted to the Pitocin. They stopped it as soon as they started it. My body went straight into labor, and within 6.5 hours, my baby girl was out. I think a notable thing to mention is I didn't tear. The only tear that I had with my first daughter was because her elbow had come out with her face. She was a sunny side up baby, and she flipped during birth, and her elbow is actually what caused me to rip on the inside. So that was, honestly, I attribute all of it to evening primrose oil 100%. And by the way, no, I'm not sponsored by them or have ever been contacted by anybody that, you know, manufacturers. As far as why I believe I didn't tear, so you were going to want to take, and again, I wouldn't start until 38 weeks pregnant. This is also something you're going to want to be very sanitary about. You should always be sanitary when it comes to your vagina, like anything relating that, you should be very sanitary, but especially with this, because when you're pregnant, you don't want any bacteria, you don't want to get any bacteria infections or anything like that. So always make sure to wash your hands, make sure everything's sterilized, make sure you're in a good environment. I personally have my spouse help me with this, but you can do it yourself as well, depending on your comfort level. I think it's nice having my spouse do it because he can see better than I can, because the bump is in the way, and it's just easier that way, personally. So the evening primrose oil, because it is that fatty acid and it is help softening things, it's also nice to have that oil inside of the vagina canal, I guess you should say, because it stretches so much when you, I mean, it goes all the way to a 10 when you have a baby, the size of a baby's head. So that's not something it normally does all the time. So it's something that you should prepare your body a little bit for getting the elasticity up. And helping, just like the skin on your face, you want your skin to, you know, not get as many wrinkles, and you want to take care of it by putting creams and stuff like that on it. It's the same thing down there. So when you're knowing that you're going to give birth pretty soon and you're, you know, nearing 38 weeks, you kind of want to prep for that. So something you can research is perineal massages, which is basically taking an oil substance like evening primrose oil, olive oil, not vegetable oil. Do not put vegetable oil. Coconut oil would be fine. Oils like that melted down, you would put it on, like, say, your thumb, and you would outstretch the bottom lip, basically, of your vaginal opening, because obviously this is all going to be way too TMI, but I wanted to be thorough because I know this is not something that we necessarily talk about all the time. So the outside, because if you're doing this and you're pushing down, you're kind of not only rubbing that oil into the skin, but you're also teaching it to stretch without ripping. So that is something that's super important to do, but research perineal massage, ask your doctor if you feel like you need to. And so that's something that I would have my husband do, as well as inserting the evening primrose oil. So how I would prepare for this is at 38 weeks at nighttime, I would poke a hole in 3 capsules of evening primrose oil with a safety pin or a needle, and make sure to keep that in a baggie. That way it stays sanitary and everything. But so wash your hands, take the needle, poke the hole in the 3 capsules and have them ready. And put your needle back and put it in a Ziploc. And then I would take olive oil and do the perineal massage. And then I would have my husband insert all 3 capsules as high as he could in my cervix without it being uncomfortable. I would also put a pad on my underwear. That way, throughout the night, the oil is going to leak out of you. The reason you poke the holes in the gel capsules is so that the oil will leak out. Coat the inside of your vagina overnight and really just absorb all of those oils, and basically get it ready and stretchy to go. This also helps bounce back from post-labor as well. I noticed that everything seemed to tighten back up for me. Kegels were a lot easier. All of that stuff is a lot easier for me after labor as well. So with my first labor, I feel like, I don't know if it was because I did have the 1 stitch on the inside or what, but I feel like because I didn't do it as often, it wasn't as comfortable for me to have intercourse. You know, after the healing process was over, it still was quite painful, and I felt like I just wasn't quite myself down there. And I will say though, after doing it with the evening primrose oil, my OB was like, you seriously bounced back. Like, it doesn't even look like you had a baby down there. Like, that's amazing. Like, I'm very happy for you that you've healed this way. So that's kind of my goal for this last and final 3rd baby for me, is to really make sure I prepare my body just as well as I did with my last pregnancy. So that way it might not end up like my first pregnancy again, where it was a little bit harder on me because I didn't do it often enough and took it seriously enough. So I hope all of these things will help you throughout your pregnancy. I hope that you don't tear. I hope you have a smooth labor and delivery. I hope your body listens to you, and that your mind and your body can be connected and everything. If you guys have any questions, feel free to leave them below. But like I said, just talk to your doctor, talk to your midwife, talk to whoever you feel like you trust to console on this kind of thing. And do your research. But that's pretty much all I have for you guys today. I hope you guys enjoyed this video and found it a little bit informative. If you guys did, please like and subscribe below to my channel, and let me know if you would like to hear about any other videos. I have lots of tips and tricks, so if you have any questions on any part of pregnancy, please let me know, or parenting even. And yeah, I will see you guys in my next video.